And that brings us directly into our first interview for today. As you know, it is a Monday. It is the 3rd of July, actually, 2023. And it's gone exactly 25 to 1. So Employee Wellness Week, it is basically this week. And it is an annual national health event that designed to bring awareness of the importance of maintaining the health and also well-being of the employees in the workplace and within their home environment. And that's from, it basically runs from the 3rd, so which is today, up until the 7th of July. And the Heart and Stroke Foundation of South Africa uses this week to highlight the importance of heart and brain health, as well as the associated risk factors given that cardiovascular disease has in South Africa. And joining me on the line is Hayley Cimring. She is a nutrition science team leader and a registered dietitian at the Heart and Stroke Foundation of South Africa. So good afternoon, Hayley. How are you today?
Good afternoon. I'm doing well, and thank you for the opportunity to speak to your listeners today.
And it's only a pleasure to be talking to you, and especially around such an important topic. As I read in the beginning, I spoke about the week basically serves and the importance about Employee Wellness Week. So why specifically is Employee Wellness Week so important, or why should there be recognition for this week?
Well, the primary goal for the Employees Wellness Week is to encourage employers and the employees to understand the importance of living a healthy lifestyle and adopting healthy behaviors. And most or many employees suffer from burnout as a result of a demanding job, and this interferes with carrying out daily activities, thus affecting productivity. So as a foundation, our focus is on non-communicable diseases, and in particular, cardiovascular disease and cerebrovascular diseases. And these diseases are the highest burden of disease in South Africa. And the good news is that heart disease, strokes, and associated risk factors may be prevented by adopting healthy behaviors.
And very importantly, very interesting also that you spoke about cardiovascular disease, as it is known as a silent killer also. It's something that creeps up on you. So there's no real symptoms that basically indicate that you are going through that. And you spoke about why this week is so important. So therefore, it is important to ask, like, what programs does the Heart and Stroke Foundation have in place to educate or advocate for the importance of Employee Wellness Week, especially in our country, to, like you spoke about burnout also. So that comes down to our mental state not being intact. And you do know we do live a busy life. So not all people are very fortunate enough to take time for themselves.
Yes, so the World Health Organization Constitution states that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease. A healthy workforce is a productive workforce, and the benefits of being proactive to lower the risk of medical conditions, including mental health, should be at the heart of any employee's priority list. So employers who invest in the well-being of their employees make a positive impact, like lower absenteeism and lower risk of disability and lifestyle diseases such as high blood pressure, diabetes, and obesity. So at the Heart and Stroke Foundation South Africa, we offer health risk assessments, health talks, and information material to the public and private sector workforce as a way of promoting workplace wellness. And the private sector does pay a nominal cost to the foundation for our employee wellness program.
Hayley, now therefore, can you maybe walk us through some of the challenges people face that affects their health and productivity, and also taking in account when we do speak about taking care of your mental state and not burning out, and why employee wellness is so important to create productivity at the end of the day. What about individuals that's in a job that's quite dramatic, like say a police officer, and what they basically see on a day-to-day basis, which have an impact on their mental health and productivity at the end of the day? Or take a social worker that needs to work with children and that are exposed to these traumatic experience on a day-to-day basis.
Yes, so stress can stem from different demands at work, including deadlines, long working hours, and this can be complicated by difficulties within the home environment or the community and public spaces. And then violence and unsafe spaces add to employees' overall stress, as you were saying. And stress becomes harmful when it is excessive, chronic, and poorly managed. So experiencing high levels of stress often leads to unhealthy behaviors, of which most of them are major risk factors for heart diseases and strokes, such as consuming foods high in salt, sugar, and fats, excessive alcohol consumption, tobacco smoking or vaping, and lack of physical activity. And this often leads to non-communicable diseases like heart disease, hypertension, diabetes, obesity, and strokes. So these individuals then who have these symptoms and risk factors often have an increased absenteeism rate and decreased productivity, and then often these conditions also coexist with high levels of distress, depression, and anxiety. But the Foundation adopts a health promotion and disease prevention approach to improve the overall health in the workplace. And important behaviors like healthy diets, exercises, and managing stress is key to reducing the burden of heart attacks and strokes and other associated diseases.
So basically what you are saying is the lifestyle that we do live has an impact on our productivity at the end of the day. So how can employees be more proactive when it comes to living a healthier lifestyle and improving those or getting rid of those bad habits, and also taking in account for someone that maybe work a 14-hour shift or a 16-hour shift? It's not always possible for them to go to a gym or to get physical exercise in because they come from a shift, they are tired, they go to bed, they sleep, and then the cycle basically repeats itself. So how can we be more productive, or if you can maybe convey tips what they can also adjust to their everyday lifestyles?
Well, firstly, employers can be proactive when it comes to the health of their employees, and all employers should try their best to help ensure the well-being of their employees, and they should be investing in employee wellness days. So employers who invest in the well-being of their employees have lower absenteeism, lower risk of disability and lifestyle diseases amongst their employees. And our foundation's health promotion and disease prevention programs focuses on heart and brain health and are essential to creating the well-being in the workplace. So we conduct health risk assessments. It's an important pillar of our health promotion program, and this includes assessing current health status as well as measuring blood pressure, blood cholesterol and blood glucose level, and body mass index, mental health assessment. And these are ways of ascertaining who is at risk so they can be referred for appropriate medical care. But health is also still an individual responsibility. So I'll give you a few ways that employees can improve their health at work. Firstly, to eat well. It's one of the best weapons you have in the fight against heart disease. Then we have something which we call portion with caution. So when packing your lunchbox or plating your meal at the staff canteen, make sure to keep an eye on your portion sizes. You should plate enough that you feel full afterwards, which keeps you from snacking too much in the afternoon, yet not too much that you are overeating or wasting food. And when we talk about using the plate model as a golden rule of thumb, a quarter of your plate should be starchy, high-fiber foods like brown rice, sweet potatoes, and butternuts. A quarter protein food like lean chicken or mince, and the quarter the non-starchy vegetables and salad like broccoli, cauliflower, and carrots. Then employees can also opt for the stairs instead of the elevator. That's a great way to work towards the 150 minutes per week recommended for an adult. Then you get things like team building activities such as group outings that can help employees to build relationships and improve their mental and emotional well-being. And even laughing. Don't allow work to become too mundane. So take time to share a joke with a colleague during your lunchtime walk. And laughter is also a great stress reliever. Then important it is to snack well, like choosing to snack on fruit and unsweetened yogurt, as well as unsalted nuts or fresh cut veggies during your workday, instead of crisps and chocolate. And then it's important to to stay hydrated. So drink at least 8 glasses of water a day.
Yes, definitely. And like you've mentioned, the important thing around that is that it should be our responsibility and individuals' responsibility, no one else, to take better care of our health when it comes to that. And also a very interesting thing that you've mentioned when we do speak about the portion sizes and what needs to be on your plate and so forth. But also, it's very costly also to eat healthier than eating unhealthier. Do you feel that is why so many people tend to go the unhealthy route, because it's much cheaper to eat or to live that lifestyle than living a healthier lifestyle? How can we improve or balance or find the balance between the two?
Yes, that is very important. But there are ways to eat more healthy foods, healthy, affordable foods. For example, always choose fruit and vegetables that are in season that will cost less. If fruit becomes too expensive, you could always choose veggies. Then beans and lentils are a more affordable form of protein. They also add extra flavor to dishes and can be used to make dishes go further. Then you can buy in bulk. That often helps to save money. And then a simple thing like growing your own vegetable garden can help you to produce your own healthy veggies, and that obviously will save you money too.
And then lastly, in conclusion, Hayley, because we are running out of time, so since this week serves as Employee Wellness Week, is there anything specific that the Heart and Stroke Foundation are doing to advocate or to raise awareness around this week?
Yes, so we believe in the concept of holistic health, and that is an approach to wellness that simultaneously addresses the physical, mental, emotional, social, and spiritual components of health. And we can help employees understand that being healthy is not just about a diet, but rather long-term habits, which are a lifestyle. So, as I said, we offer health risk assessments. We offer health education and counseling by certified professionals. We also give advice on getting in exercise when you think there's no time to do it. Also tips on how to lower stress levels effectively and how you can create a healthy working environment that is conducive to productivity in the workplace.
And lastly, if someone wants more information, like you've mentioned, you also work very closely with corporates. So if there's maybe an employer that wants to reach out to you to create a better wellness program for their employees or a better working environment, how do they make contact?
Yes, so thank you for the question. They can view our website. That's at www.heartfoundation.co.za for more information on our services or health-related topics. But in the event that employers are interested in our employee wellness programs, we tailor our health program according to the company's needs. So employees can contact our head office, and the number is 021-422-1586.
Just repeat the number again.
Our number for our head office is 021-422-1586. So do give us a call. And as I said, we do tailor our health programs according to your company's needs.
Thank you very much, Hayley, for taking the time to speak to us today. Again, the number is 021-422-1586, or the best way to go via www.heartfoundation.co.za. Are there any additional words in closing?
I'd like to just give your listeners a bit of advice in closing and inform them that the Heart and Stroke Foundation South Africa is at the heart and brain health of employee wellness. So our program can benefit your business and employees by keeping staff healthy, lowering absenteeism and risk of disability.
Thank you very much, Hayley, for taking the time to speak to us today. Have an amazing day further. Bye.
It's a pleasure, and do reach out and contact us. You've got our head office number.
Definitely will do. Have a good day further. Bye.
Thank you, and thank you for the opportunity. Bye-bye.
89.5 FM.